UN agencies are appealing for 2 7-day ceasefires in the Israel-Hamas conflict to allow for a mass polio vaccination campaign. A 10-month-old baby has been confirmed with the highly infectious condition, Gaza's first polio case in 25 years. Simon Eccleshall is from Médecins Sans Frontières and is with me in the studio. Simon, thanks so much for coming in.
You're welcome.
How devastating a situation could this become?
This is really devastating news. As you're aware, polio is a highly infectious, highly contagious disease. It typically affects our children under the age of 5. And unfortunately, 1 in 200 children who get infected with the polio virus will suffer irreversible paralysis. So it's a very concerning condition that there's been now 1 and suspected more cases of polio in the Gaza Strip.
Do we know what proportion of young children, babies, are not vaccinated against polio?
Yes, we have a pretty good idea. The vaccination coverage rate in Gaza was excellent. As you mentioned, 25 years ago, we were able to eradicate polio in Gaza. Since 2022, we estimate that the rate of vaccination has dropped from about 99% of children to now below 90%, and that's causing the risk of a massive outbreak of polio.
So this is the first baby, this 10-month-old, to have polio in Gaza for, as you say, 25 years. How has this disease re-emerged?
Yes, it's a very good question. There's suspicion that the virus that is there with polio has entered Gaza in the last few months, perhaps since the end of 2023, possibly from a neighbouring region such as Egypt. But until the epidemiology is done on the virus, we won't know exactly what strain it is. But it's in these sort of extremely unhygienic conditions that a disease like polio is able to thrive. And we can't emphasise enough just how much water, the sanitation and the hygiene play an impact in the spread of an outbreak of polio.
And how much is time of the essence, Simon? How soon do you have
critical.
To get in there?
Yes, Ros, we need to get in with those vaccination campaigns immediately. As you've mentioned, there's been a call for a ceasefire, 2 periods of 7 days, to enable hundreds of vaccination teams to enter Gaza, thousands of health workers, to try and administer an estimated 1.6 million vaccine doses to over 640,000 Palestinian children. That's a massive effort required.
Are you optimistic of getting those 2 ceasefires? And who are you asking? Who are you going to for this?
So we would love to be optimistic, and we are really calling on the government of Israel and Hamas to allow a humanitarian pause, enough time for medical teams to enter Gaza to be able to do this vaccination. We have the vaccines, we have the resources to be able to do it. It really requires agreement from both parties to the conflict to a short humanitarian pause. Of course, that will only address the vaccination. What we need to really do is work on addressing the water, the sanitation, the hygiene issues that have been created where 1.7 million people are living in a tiny strip of land. And that requires a permanent ceasefire.
But on that vaccination campaign, how do you roll such a large-scale operation out? How many people would you have to reach to vaccinate?
Well, as I said, the target would be 640,000 children. That would require thousands of health workers, mobilising the entire health force within Gaza. And yes, it would be a mammoth undertaking. It would require days and days of training and administration in vaccine in, as I've said, very unhygienic conditions. So it's a tall order, even if we are given that window of 7 days.
And you still have MSF personnel on the ground in Gaza, do you?
We do. We have MSF workers providing immediate health care to the victims of the conflict. We're treating still a lot of war wounded. We're treating complex injuries. There's trauma patients. There's people with ongoing chronic diseases that don't get access to health care. So we're desperately trying to medically evacuate people and, where possible, substitute for a broken health system inside Gaza.
Simon Eccleshall, thank you.
You're welcome.